Welcome to the Inset II Visual Product Guide. Wash your hands before inserting Inset II. Recommended injection areas. Don't place an area right next to your previous place of insertion. Clean the area for insertion with a disinfectant as directed by your healthcare team. Be sure the area is dry before inserting Inset II. Check the tamper-proof seal for damages before pulling the red tape. Do not use device if the seal has been broken. Pull the red tape to remove the seal. Remove the sterile paper. Press the 3 raised dots on each side of the lid firmly with one hand and lift up with the other hand. Be careful not to bend or touch the Inset II introducer needle when preparing the inserter and infusion set. Do not discard the lid as it must be used for safe disposal after insertion. If the infusion set is not securely placed in the insertion device with the needle pointing straight ahead prior to insertion, pain or minor injury may occur. To avoid this, please ensure that the following steps are taken gently so the infusion set is not loosened or removed by accident. Unwinding the tubing. Carefully twist the beginning of the tubing out of the slot. Pull up gently. Now, unwind the tubing from the insertion device by pulling it carefully upwards. Do not touch the Inset II introducer needle when unwinding the tubing. Be careful not to pull too hard when the tubing is fully released. You could accidentally remove the infusion set from the introducer needle. Connect Inset II to a cartridge and the pump. Prime the infusion set. Ensure there are no air bubbles in the tubing or Inset II. Consult pump manufacturer's instructions for use when connecting Inset II to the insulin pump. Caution! When priming the infusion set, hold Inset II with the needle pointing down to ensure that medication does not come in contact with the adhesive backing paper. Pull up gently to remove the adhesive backing paper. Prepare the inserter. Place fingers on lined indentations. Press lined indentations on each side. Pull spring until you hear a click. Caution! Be careful not to touch the introducer needle of the Inset II when preparing the inserter. Carefully remove the needle guard by gently twisting and then pulling it. Caution! Before positioning Inset II over clean insertion set, place the tubing in the slot to ensure that the tubing is not caught underneath the device during insertion. Insert the Inset II. Position Inset II over the insertion site. Simultaneously press the round indentations on either side of the insertion device to insert Inset II. Push gently on the center of the inserter to secure the adhesive on the skin. Remove the inserter introducer needle by grasping the center and pulling it gently back. Massage the tape thoroughly to the skin. Fill the empty space in the cannula with the following amount of insulin. Discuss this procedure with your healthcare team. Push the lid back until you hear a click. With the lid properly connected, Inset II can be disposed of safely. Disconnecting. Inset II allows you to temporarily disconnect your pump without having to change the infusion set. Hold the adhesive tape in place by placing a finger just in front of the cannula housing and gently squeeze the sides of the Inset II. Pull the connector needle straight out from the cannula housing. Insert the disconnect cover into the cannula housing until you hear a click. Reconnecting. Prime the infusion set according to manufacturer's instructions until medication dispenses from the needle. Place a finger on the adhesive tape just in front of the cannula housing. Push the connector needle straight in until you hear a click.